Welcome to Health 360, the show where we look at wellness from every angle to help you live your healthiest, most vibrant life. And I'm your host, Oniye Shukrah. Today, we're stripping away the labels and looking past the marketing to uncover a silent crisis hiding right in plain sight: hidden malnutrition. When we hear the word malnutrition, we often picture extreme food deprivation. But today, we're shifting that definition. It is possible to eat 3 meals a day, feel completely full, and still be cellularly starving. Over the next 30 minutes, we're going to debunk the biggest dietary myths, track the real impact of ultra-processed convenience food, and look at exactly what happens to your cells when they don't get what they need. Plus, we'll run through a quick-fire bust or thrust segment to see if your daily habits are actually healthy or just clever marketing. Joining us to break it all down is nutrition specialist, Dr. Jamila Lawal.
Thank you so much for having me.
Thank you for coming,
I'm so
Doctor.
excited to be here.
Okay, so yes, let's dive in. Okay, so doctor, the first question here is, when we hear the term malnutrition, the mind often jumps to severe, visible wasting or extreme food deprivation. Is that a complete picture of malnutrition today, or is there a broader clinical definition we're missing?
Absolutely. I get that a lot. When people hear malnutrition, the first thing that comes to mind is a severely undernourished child, like the picture of some malnourished child in some country in sub-Saharan Africa. I think that's the first picture that comes to, to the minds of people. But honestly, malnutrition is a broader term that covers undernutrition, overnutrition, and then we'll have micronutrient deficiency. So it's not just, when you just say malnutrition, like people think it's undernutrition, but it's not just undernutrition. So there are 3 aspects to it: undernutrition, overnutrition, and micronutrient deficiency.
Okay, doctor, Can you explain the 3 terms to us?
All right, so I'll just make it very easy, just, like in layman terms. And when you talk about undernutrition, is when an individual is not taking in enough nutrients that's sufficient, or adequate nutrient sufficient, for the body's processes. And then you have overnutrition on the other hand, where an individual is taking more nutrients that their body requires. And then you have micronutrient deficiencies. This is when an individual is not taking adequate micronutrients, or is taking much more micronutrients that
and they need.
And they need. So you have micronutrients deficiency. But basically, it's overnutrition, undernutrition, and mostly micronutrient deficiency. Yeah.
That is a new knowledge. Thank you.
You're welcome.
Can you paint a picture of a typically hidden malnutrition patient looks like when they walk, when they talk to you?
Yeah. So when you talk about hidden, hidden malnutrition, is that what you mentioned?
Yes.
We'll call it hidden hunger. And you said, what are the symptoms when the patient walks in? What are the typical symptoms that you see? And it's why we call it hidden is because you can see an apparently healthy individual who looks healthy, who looks plump, can even be overweight, and it doesn't appear that they're sick in any way. So you cannot just see an individual walking and say, this person has hidden hunger. It's very, there could be some signs, but it's difficult to be able to just diagnose and say this person has, has hidden hunger. And so that's why we call it hidden hunger, because it's not apparent. The person, you would have had to listen to some symptoms and then do some blood work to now realize that, this person is actually micronutrient deficient or has what we call hidden hunger. And hidden hunger is something that a lot of people suffer from because you cannot see it. So it's hidden. You can look apparently healthy, you can be overweight and you'll be like, how can you say this person is micronutrient deficient? Well, that's why it's called hidden hunger. So you cannot just, you can't see it. It's not apparent. It's not something that you can see physically. There could be some signs, but it's not usually something that's apparent.
Yeah. So what most people think is malnutrition, like you just said earlier, a skinny person that looks obviously skinny, might not be malnourished.
Yes, skinny, or the image of, kwashiorkor, protein, energy malnutrition. Yes, that's what people think, but yeah.
So instead, it might be somebody that looks robust and the skin is skinny.
Absolutely.
Okay.
Yeah.
So it sounds contra-nutritive, but is it clinically possible for someone to consume 3 meals a day, maintain a stable weight, or even gain weight and still be severely malnourished? How does that happen biologically?
Absolutely. You can eat, 3 square meals. You can eat, a lot of food. Like, you see someone who is, very comfortable, eating very well, and, physically they look okay, but biologically other things are going on. And yes, so it's possible. One of them, highest prevalence of, micronutrient deficiencies that we find, especially within our communities or in our society, is iron deficiency anemia. So you see, and most women, we have like, 50%, over 50% of women of reproductive age are micronutrient deficient in I have iron deficiency anemia. So you could actually be looking very healthy, but then you have symptoms like, I have constant headaches, or I'm weak, or I'm not able to concentrate, and it may just be that you are, you're anemic, you're deficient in iron. So yes, biologically, and because these micronutrients are so important, especially with the body's biochemical processes. They are needed in very, minute amounts, but they play such an important role. For instance, iron, so important in, blood formation. You have magnesium, important in sleep. It's involved in hundreds of biochemical, processes in the body. You have zinc, so all of these micronutrients some of the micronutrients are really deficient in our diet, and as a society. Vitamin A, especially for children. Iron is so important for children as well. And vitamin A, it supports immunity. Iron is so important in cognitive development of children, and concentration as well in adults. For reproductive health, women, go through their monthly cycles and they lose blood. And so iron is very important in, I'm replacing the blood that's, is lost, and for, just mental clarity. And so it's biologically, yes, you can look okay physically, but biologically, because you lack these nutrients, it comes with its own consequences. Yeah.
And so you mentioned iron a lot. What food can we find iron?
Oh, lots of food. We're blessed with a lot of food. I say we don't have a food problem. The only problem, the major problem we have, is it's information, education, and information, right food, then access as well. And then discipline, right? So yes, so we have a lifestyle issue, but food, is available. So, instance, we talked about iron. You can get that in, in your proteins like meat. You can get that in beans. You can get iron in your green leafy vegetables, and that's why you hear people go to the hospital and like, oh, I don't have blood. You hear that, in layman terms, I don't have blood. The doctor said I should go back home and take a lot of vegetables and blend ugu and take
milk.
The milk is not actually necessary, but then take lots of vegetables, or eat a lot of cayenne chiki, which is tripe, because those also are a great source of iron. And then you see that over the weeks, over time, like the blood improves, and so they come back and be like, my blood is okay now, I'm not so yeah. So foods like that, vegetables, ugu, aleyahu, zogale, they all contain iron.
I was expecting to hear plantain, but I didn't hear it.
Yeah, it is, but I'm not good. I'm talking about what's really easily accessible and available for, especially for the environment.
For most Nigerians, when you mention iron, the first thing that comes to mind is plantain.
Yeah.
I'm not even...
So, not for most Nigerians, because it depends on where you're coming from. Probably from the south side, because they have more of that. And here, plantain can be expensive. And even from the south, sometimes plantain can become expensive, right? It depends on the time of the year. But what I know is easily available and easily accessible, even at the back of your kitchen, is vegetables. Ugu, water leaf, and all of that, scent leaves, and so.
Okay, so what is a common food combination people eat daily, thinking it's substantial, but it's actually empty in nutrients?
There are a lot.
Don't come for noodles.
There are a lot of them. There are a lot. A lot. So. I was having a conversation with someone 2 weeks ago, and she was like, she tries a lot, for breakfast. She does bread, for herself and her kids, bread. I'm like, so what do you add to bread? She was like, she just adds to spread. So they have like 3 to 4 slices of bread and hot chocolate in the morning. And, so she doesn't joke with her children's food. And I'm like, what did you say? And so bread and hot chocolate is a typical meal that people have in the morning, and they think, they eat and they're full. They think it's okay, but it's not. It's not nutrient dense. It's deficient in a lot of important nutrients. Another one can be it's kose akara and custard. Yeah, not necessarily even pap. Okay, maybe even pap, and they think it's nutrient dense, it's balanced, but it's still not balanced. So yam and stew, it's not balanced. It's food, it's calorie dense, but it's still not, it's not balanced. Yeah, it's not nutrient dense. Yeah, so those are examples. I could go on and on. I don't want it to look like I'm going. I don't want to make it cancel all the foods. I mean, noodles as well, instant noodles. Yeah, you know, sometimes people try to sprinkle some chopped carrots on it. And
some of us love the group chats. Okay, so a quick one. I often hear brown bread are healthier than white bread. How true is that?
So, you know, in that instance, I'm not going to demonize bread. You know, these foods can still make, all these foods I mentioned earlier can still be a part of a healthy diet, but it all depends on how much you're eating and what way you're eating it, right? So when we talk about white bread and brown bread, what would I choose brown bread over white bread? Absolutely, I would choose brown bread over white bread. Why? Because the brown bread still has some of the fiber left in it. It's not overly processed. White bread is made from white flour that has been processed. Most of the fiber has been removed out of it, right? So you just have simple carbohydrate, which is just white flour that really does nothing for you than provide you with, it's just really, it's a simple sugar. Most of the time it just spikes your sugar, and it really does nothing for you than provide energy that is burnt off, within a few minutes or like less in an hour. But if you have a fiber rich option like brown bread, it's got fiber, it's still got its vitamins as part of it. It still maintains some of the nutrients that come with the plant. So I would say brown bread is healthier than white bread in that instance because it still has its B vitamins, it has fiber. When you eat it, it does not spike your blood glucose the same way that the white bread is going to spike your blood glucose. And so this is very important, especially for people who are diabetic or just want to live a healthy lifestyle, or pre-diabetic, or you just want to live, a healthy lifestyle. So when you eat a slice of brown bread, it helps you stay fuller for longer. Why? Because it contains fiber, but white bread does not contain that fiber. So as soon as you eat it, it just goes, and the next 1-2 hours you're hungry and you're looking for something sweet again, you're craving something again within a short period of time. So yes, brown bread is better than white bread because it contains its nutrients. It has not been stripped of its nutrients, but white has been bleached, it's been stripped of its nutrients, and that's not why it's not the healthier option. So if you have these choices, take the brown bread instead of the white.
I had to ask because a lot of us are breadholic and we just don't know we're eating sugar in a fluffy form.
Yeah, that's it. And it's not like you can still eat your white bread, but if you're eating your white bread, then you want to ensure that you're pairing it with, lean protein, like good quality protein and vegetables. That way you make it more nutrient dense. It's not going there to just spike your blood glucose. It's giving you more than just carbohydrates, right? So you make it balanced and then limit your portion sizes. Yeah, that's very important.
Okay, so my next question is, many people measure a good diet by how they feel. From a nutritional science standpoint, what is the difference between caloric safety and cellular nourishment?
If I get you clearly, you're asking what's the difference between calorie satiety and what? Cellular nourishment, you said. So the difference between calorie satiety and cellular nourishment is this. Calorie satiety is when one eats, you're eating food, you eat this food just to fill you up, right? The intention is that I'm eating this food and I want to eat it to fill myself up and to feel good. And so it's like taking a cup of ice cream, right? I'm taking it with the intention that I want to eat this ice cream, and I know when I eat this jar of ice cream, I'm going to be full. So you feel satiated, you feel full, right? And so you eat that. That's the intention. But then you now have cellular cellular
nourishment.
Cellular nourishment is when you eat with intentionality. I'm not just eating this food to fill myself up. I'm eating it with the intention to nourish my cells, to nourish my body for better health. And so cellular nourishment is actually, it's actually better that you look at food in that way. When you want to eat, you ask yourself, what is this going to do for me, right? And it's a better way to look at food. It's a better way to look at nutrition. Rather than just eating for satisfaction, you eat to nourish yourself, to nourish your cells, to nourish your body. And so that's the difference. So
for the gain and not just for the fullness.
Not just for the fullness, because you can just eat a jar of ice cream and you feel full. You can just eat, pounded yam and ogbono soup, and you feel full, you'll be satisfied. But what about cellular nourishment? Are you looking at it in that regard? Okay, I want to eat this pounded yam. How is it going to nourish my cells? So I'll be thinking of, I'm taking this small portion of pounded yam, and I'm going to add, vegetable soup, a large portion of vegetable soup, very small fist of pounded yam, and ensure that I have a lot of fish in that plate. That's cellular nourishment. Not just about feeling full, but about nourishing my overall body. Yeah.
Okay, what is an example of a meal that leaves us feeling completely stuffed but leaves ourselves starving?
Lots. So example of a food that can make you feel full but leaves you starving is 4 slices of bread and hot chocolate. Just like I mentioned, very easy because it's something that we eat all the time.
All the time.
You eat the food, 4 slices of bread, hot chocolate, even bread and soda or something, and then you feel full. And then in the next 1 to 2 hours, you're hungry again. Why? Because most of what you just consumed is empty calories. Your body just burns it and doesn't really do anything for you. There's no fiber that slows down digestion. There's no protein that also makes you feel full, because when you eat protein, you feel satiated for longer. Your body even expends more energy in burning protein, right? So you are not like storing a lot of calories. Your body expends energy in burning protein, and it makes you feel full for much longer. So you can eat all of the sweet foods, the sodas, the sweet drinks, the plain carbohydrates, the simple carbohydrates like your white bread, and that doesn't have any fiber, or biscuits or cakes. You feel full that moment, but in the next 1 hour, 2 hours, you are craving something sweet again. And so that's how weight gain begins. And you're wondering, I just ate this food, a large, serving of pounded yam. You feel very full, but the next thing you are weak, you're feeling sleepy. Why? Because it gives you that sugar rush. You feel energized immediately after taking it, and then before you know it, your body has broken it down. It crashes, and you're back, to square one again.
Okay, a quick question here.
Yeah.
Beans. Is it protein or carbohydrate?
I know what happened. I don't know why it was. I think our primary school teachers.
Yes. Yes.
Deceived us. I won't say they lied to us. But beans is a complex carbohydrate that's rich in protein.
Oh my God, Nigerians will have been deceived.
No, don't take it that way. It's still a great source of protein. But beans, so it's just simple. Beans is a complex carbohydrate that contains a good, source of protein, but it's not entirely protein. It's about 60% carbohydrates, but good quality carbohydrates, and then some protein. Okay. So yes, so you can still eat your beans. I mean, beans is one of the food groups that we grow locally. We eat in different ways that I encourage people to eat a lot. So it provides you energy. It's the protein. Of course, it's still important to add some other sources of protein to eat. It's rich in fiber, which is really great. And the fiber that it has is also like slow release. So it's it fills you up. You feel full, and for longer. It doesn't just like just make you feel hungry immediately after eating it. So it's a great meal, but it's not complete protein. Yeah.
Okay, so let's move to what most people are waiting to hear. Okay. Modern diets rely heavily on convenient, ultra-processed foods and refined sugar. What is about the composition of this food that leaves a person oft but undernourished?
So modern foods, especially they are easily accessible, right? But the problem is that they are overly processed. They contain trans fats. They are processed, mostly stripped of their nutrients. Like I mentioned, fiber most of the time is stripped off. So this is mostly starch. So starch, it could be from corn, it could be from wheat, it could be, but most of the fiber is gone already. In fact, the fiber is gone already. The nutrients that are part of it is already gone. So you see that most of the nutrients in this processed foods are gone, and so that's where it's convenient food. It's easily accessible, and most of them are affordable. It cuts down your time in the kitchen. But what about the nutrients, right? So that's where the issue is. What about the nutrients? Most of the time they are stripped of nutrients. The white breads, the biscuits, the instant noodles, all of that, they're stripped of their nutrients. The plain custard powders are just starch powders with color in it and some flavoring, and there's nothing more. And so that's where the problem is. So people need to be aware of what they're taking. It's convenient, yes, but how much of the nutrients that your body requires is left in it, right? So what's important is finding out if you're going to do convenient foods. Learn to read packaging, learn to read the nutrition facts, learn to read the nutrition information behind the packaging. If it's not got nutrition information, you don't have to get it right. Get other options, so know what you're taking. And if you need to substitute, because I cannot say people should not totally eat their noodles, but I'm going to say if you're really going to have noodles, then make sure that your plate is packed full of vegetables, like fresh vegetables, steamed, and let it make up half of your plate, and then make sure that you add some good quality protein to that plate just to make it nutrient dense. Then you can have if you really do need to have the noodles, then you can go ahead and have it. So that's the problem with convenience convenience food, most of the important nutrients have been stripped off of it, and it makes it really just empty calories that you're having. It's not really doing anything good for your body.
Okay, so this brings me to our next question. We often discuss non-communicable conditions like cardiovascular disease or metabolic syndrome as a lifestyle disease. Would it be accurate to say that these conditions are often stem from long-term unaddressed nutritional gaps?
So yes, I will say to an extent, most of these metabolic diseases that we come across are diseases that come as a result of lifestyle, right? We call them lifestyle diseases. We call them the metabolic syndrome, and you see that it's usually adult onset diseases that come usually after like midlife, and so what should be the trend that we see with research is that a lot of habits that we form when we're younger, when we're in our 20s and our 30s, are habits that at the end of the day, by the time you're reaching your late 30s and you're entering your 40s and 50s, you begin to see the results of the impact of the choices that you made earlier on. So take, for instance, a lot of people with high blood pressure or who become diabetic in their 30s or 40s, if you look at the lifestyle that they have had earlier in their 20s or 30s, you see that they we're not necessarily eating healthy, for instance, so that's type 2 diabetes. There's type 1 diabetes, which is, is genetic, people were born with it, but type 2 is adult onset, it comes in later, and so you see sugar intake, eating of overly processed foods, not necessarily exercising, so people are generally not very healthy, not conscious of the foods that they eat, and you already begin to see this when you see their blood. When you do blood work, you're beginning to see the signs, and you're saying you better cut down on the sugar you're eating. You better cut down on the fat intake, your fat intake, the processed foods, the processed sugars, the added sugars. Cut down on all of these things, and then you begin to see results, right? So you're wondering, wow, I was never diabetic. What happened? Why am I suddenly? Doctor says my sugar is too high. What are you doing? And this comes, at the end, people are beginning to see this in 30s now. High blood pressure. Before now, we used to think that it was just, our parents. But now you're seeing younger people, right? So exercise, very important. The amount of sodium that we have in food, we have to watch that. The amount of sugars, added sugars to foods. These are all things that we need to pay attention to, especially when it comes to our foods. Then processed foods, they are very unhealthy because why? They are not whole foods anymore. They've been stripped of their fiber, stripped of important nutrients, and you're just eating sugars, right? Just simple sugars that do more harm to your body than good. The more you're eating these things, your body at some point is no longer able to, you become insulin resistant. And why? Because you're taking so much more sugar than your body necessarily needs, right? And so you have this glucose just floating around, and so at some point your body is saying, I can no longer, even the insulin comes out, it's no longer able to, it cannot process the sugar the way it used to, and so before you know it, like you're insulin resistant, and then you have pre-diabetes, which can lead to diabetes. But when people, the good thing with this, because they are lifestyle diseases, and as soon as you begin to make certain lifestyle changes, you begin to see the positive impacts. As soon as you say, oh, cut down soda, cut down on this, you see people are like, I feel healthier, I'm losing the fat around my waistline, I feel more energized, I'm able to work more, oh, I'm sleeping better. Why? These are just subtle lifestyle changes. I'm working more, I'm taking my 10,000 steps, I'm losing the weight, I feel more energy, I do not feel, the brain fog, I don't, like that. Fatigue, yeah. So yeah.
Can you walk us through how a long-term poor diet directly transitions into conditions like type 2 diabetes or hypertension?
Yeah, just like I mentioned, long-term poor diet, like too much sugary foods, too much processed foods. At the end of the day, after some time, your body is not able to process that sugar. It's not able to, and so you become insulin resistant.
Yes, I know a lot of 20-year-olds that take 2 sodas per day, and to top it all, they're still going to eat rice.
You still eat rice. It's typical, not just teenagers. It's a typical. You see an average Nigerian doesn't even know that all of these foods are unhealthy, right? And then you're gaining weight. You don't understand why I'm gaining this weight. I'm not losing it. I'm having, everybody is carrying his stomach, tummy. Yes, adult men are carrying tummies and bellies and all of that, and you're not able to lose the weight. Why? This is where it's stemming from. You are not having enough fiber in your food, you're eating overly processed foods, you're having added sugars, you're gaining weight, your BP is shooting up, you've gone to the doctor and they say your sugar is too high, you need to cut down on. So that is it. It all, at the end of the day, whatever you eat today. I always say, whatever you eat today, when you look at it, remember that anything you eat is going to contribute to either giving you better health or increasing your risk for disease. So you have to choose wisely. Anything that you eat, when you look at it, what is it going to do for me? That's a question you should be asking. What is it going to do for me? Is it going to just satisfy me? I mean, you get once in a while you can do, you can have cravings. You can, sweets make the world go around, right? I mean, once in a while, yes, but your focus should be on whole foods. So what is this food going to do for me? As I'm eating this thing, what is it going to do? It's because whatever you eat is going to go back and form a part of your body. Is it this sugars or this sodas you want to form a part of your body? Or is it this good quality, beautiful looking vegetable soup that you want to form a part of your body? So you have to make those choices. Yeah.
Okay, so looking at our current community eating habits, what are we collectively getting wrong? Is it lack of access to fresh food, or lack of nutritional awareness, or simply the convenience of modern eating habits? Because I know somebody that will tell you that stop eating all these processed foods. Sit down and eat local food. Eat plenty amala and ewedu. Then I'm like, is that even balanced? Like, are you even eating it in a balanced manner? Okay, I know it's natural, but is it even balanced?
So the problem is, I think everything you mentioned, whether it's lack of access, whether it's education, or whether it's the third thing you mentioned was whether it's the processed foods. I think it's the three areas. I'm going to cover the three areas you just mentioned. So is it access? Yes, to an extent, there are people you could say do not really have access to some of these foods that are nutrient dense. And so what I'll say that it's not just an individual issue, it's a societal issue, and it's not just something that only we individuals we should be looking at taking care of. Even the governments as well can play a role, right? And so there should be access to nutritious food for everybody. It should be accessible, it should also be affordable, right? And so another thing is knowledge. We talk about education. There's a gap in nutrition education, and so nutrition education must be taught in schools, and not just in schools. At home, people need to know, people need to be aware, right? And so that's part of the work that we do. I still advocate healthy eating. People need to be aware of what they're eating. You need to know that this is how you should eat. Your food should contain this. It should contain what is the proper portions of food, and these are the foods that you should avoid, right? So people need to have that education. People need to be informed about the kind of food that they eat. That quality is more important than quantity. And it's not just about affordability. We talk about convenience foods. Even foods as simple as I told you, we're talking about iron, and say as your ugu, you don't even have to go far to plantain. Plantain, somebody will shout like, plantain is so expensive. Yeah. Ugu, moringa, you can grow that at the back of your kitchen. I also encourage people to grow their own fruits and vegetables, because I grow vegetables as well. And so you can grow it, and vegetables are accessible and affordable all year round. You don't even have to insist on one thing. You can try other vegetables. So have a varied diet, right? And colorful vegetables, colorful foods. And so accessibility is one thing. Affordability is another. Take what you can afford. You don't have to go and buy broccoli or cauliflower, while you can use cabbage and you can use moringa, absolutely. And so we talked about convenience foods. Know what you're eating, right? It's very important. Some people don't have time these days. People are working, mothers are working, and you may not have all the time to soak grains and make, pap from scratch for your family. So if you're going to buy, pap mixes or something, instead of getting just custard powder that doesn't do anything for your family, you can make sure that whatever this fortified blended paps powders that you see in the supermarkets now, a lot of SMEs are producing. Okay, it contains millet, it contains soya beans. That's a healthier, better option. So look at what it contains, read labels, know what you're buying. Convenience foods can be good, but you just have to know what is in it, right? And sometimes you may not be able to get everything that you need from foods. Your doctor could prescribe supplementation in some cases when women are anemic or they're pregnant, and they're given, like iron supplement tablets just to help to support blood formation, because they need a lot of blood during that period. So yes, it's all, but we need to, I think knowledge is very important, and then use what you have. You don't have to go for the higher end, foods that are expensive. Use what you have and available to you.
Okay, can you give us an example of a local traditional dish that is actually very nutritious, but people kind of like underrate?
There are a lot. There's a lot. So I'll give an instance. In the north from here, we have Mir Zogali. Mir Zogali is moringa stew made from moringa leaves. And moringa leaves is one of the most nutrient-dense, vegetables that's available. And it's protein. It also contains protein. It contains iron. It contains so many essential vitamins, minerals that the body uses, but people look down on it like, like it grows behind the houses.
Yes,
So I can just say as simple as moringa stew, mirzugali. It's a very nutrient-dense vegetable that can be used in preparing a really nice soup that will go with, your swallow. Ewedu is amazing, pumpkin, we call it kabewa, rich in vitamin A. A lot of children are deficient in vitamin A, and it's a very rich source of vitamin A. So just boiling it and adding it to your, to your stew, or, to anything that you're making, pap or something, can really help to improve the nutritional profile of the food. So.
Okay, so this brings me towards the end of our segment. But before we go, we're not going without our rapid fire. We call it the bust or trust segment.
Okay.
So if it's true, you tell me trust.
Okay.
And if it's a lie, you tell me bust. Okay, so skipping breakfast or surviving on just one light meal a day is healthy, effective way to detox the body and manage weight. Bust or trust?
Bust. Bust, because just eating one meal a day, very small meal a day, as a way to live a healthy diet is not necessarily something that's sustainable for everybody. I mean, yeah, I know some people who do 1 meal a day diet trying to lose and maintain weight, or for some medical reasons. Well, those are the few instances. But no, you can still eat 3 different meals in a day, but eat them in very, in the appropriate portions, making sure that the food is balanced. So no, that is bust. Okay. What's the name? Bust or what? Bust to trust. Okay.
Just because a food product is labeled brown, like brown bread, brown sugar, or brown pasta, it means, is it automatically 100% healthy and nutrient dense compared to the white one?
Bust. Bust, because number one, brown sugar and white sugar, it has the same calories. It's sugar, and you still raise your blood, spike your blood, the same way that white sugar would. Some people even produce brown sugar by adding color. It doesn't come with the natural molasses, so you can also be deceived in that way. And foods that can appear to be healthy, touted healthy, may become unhealthy if you overdo them, right? So like we said earlier, brown bread, it has more fiber. Sometimes, if you're not sure what you're eating, it may just be coloring, right? So if you overdo it as well, it can become unhealthy. So even a healthy food can become unhealthy if you still do not watch the amount of the food that you're taking in, right? So even too much of a good thing can even become bad as well. Yes. So yes.
Okay, so this brings me to our last Bust or Trust segment. Choosing zero fat or fat-free versions of food like yogurt or salad dressing is always the healthy choice for avoiding nutritional disease.
Bust. Your body needs fat. Your hormones. They need fat,
And that is the fat most people are trying to avoid. Somebody will tell you, I don't eat this because it has too much fat in it.
No. Except, under some kind of conditions, fats it's your body actually needs fat, for, your hormones, very important. So it just depends on the kind of fat you're eating. We talked about trans fats, we talked about, saturated fats, it even depends. Just don't overdo it, right? We have a lot of good quality fat. So I will say I'd rather take whole milk than take milk that is being skimmed completely, except if I'm, obese or someone is overweight or something like that. You're like, okay, it really limits the amount of fats that you take, but your body actually does need fat. Yeah, so bust. I think I busted everything.
Okay, thank you very much, Doctor.
You're welcome.
Wonderful people. I think one key take home here today is you are what you eat.
Absolutely.
And that brings us to the end of this episode of Health 360. If there's one major takeaway from our conversation today, it's true that health is not just about filling your stomach, it's about nourishing your cells. You do not need an expensive diet or restrictive cleansers to stay healthy. Sometimes it's simple as swapping out the ultra-processed convenience for budget-friendly whole meals, starting with your very next meal. So when you're planning to buy your noodles next time, fill it with something else that's more healthy. A huge thank you to our guest, Dr. Jamila Lawal. I'm very grateful.
Thank you so much for having me.
For pulling back the curtain on eating malnutrition and giving us actionable steps to reshape our plates. If you enjoyed today's episode, make sure you hit the subscribe button, leave a review for us, and share this with a family or friend who needs to hear it. Let's keep looking at it from a full picture of health together. Until next time, I remain Oniye Shukrah. Eat well, stay mindful, and take care of your health. See you next time.